Hello, everyone. My name is Dr. Pankaj Jariwala. I am an interventional cardiologist working at Yashoda Hospital, Somajiguda, Hyderabad. And I will be discussing on some of the trials which were published in European Society of Hypertension this year. And this is one of the study which was presented. The comparative efficacy and acceptability of different antihypertensive drug classes for cardiovascular disease prevention. This is basically a systemic review and network meta-analysis. The objective is no single pill has compared all major antihypertensive drug classes head-to-head, and current guidelines gives a different recommendation for first-line agents. And this study is sought to assess the efficacy for cardiovascular disease prevention as well as acceptability across all antihypertensive drug classes. So the design was each treatment arm should have at least 100 patient years of follow-up, 1,000 patient years of follow-up. Cochrane collaboration tool was used for the risk bias, and exclusion was high risk bias were excluded from analysis. And the composite major cardiovascular event was the primary outcome, and acceptability outcome was treatment discontinuation. So all the trials of any agents against other placebo were included in this study, and around 85 trials with more than 4 lakh participants were followed up for an average of 4 years, with a mean age of 64 years and 41% females, and 15 different drug classes, combinations and placebos in the network. And the ACE inhibitors, ARBs, calcium channel blockers reduce the major cardiovascular events compared to placebo. There is a well-known trend. Even similar trends were observed with diuretics, while beta blockers and renin inhibitors did not show any significant reduction. So acceptability showed that ARBs and calcium channel blocker had a favorable rates to placebo. Diuretic shows a non-significant trends of more discontinuation. And ACE inhibitor, beta blockers, and alpha blockers were significantly more prone to treatment discontinuation compared to placebo and other agents. So this was the result of the study. And you can see the ACE inhibitors and calcium channel blockers, they favorably reduce the major cardiovascular events. And you can see the risk, which was odds ratio was 0.85 and 86. And treatment discontinuation was seen more with ACE inhibitors, beta blockers, and renin inhibitors as compared to ARB and calcium channel blockers. So this is very well known, and so this is the most comprehensive network meta-analysis of antihypertensive agents to date. And these findings indicate that ACE inhibitors, ARBs, and calcium channel blockers are the most effective agents in preventing the cardiovascular events. And based on a more beneficial acceptability profile, ARBs and CCBs may consider most appropriate as a first-line agents, although these findings should be interpreted with caution due to inconsistency. But in real practice also, we see that in Indian scenario, ARBs and CCBs are very popular antihypertensive drugs, and all Indian cardiologists also use this molecule to a large extent, and we are finding it with a similar scenario in our routine practice. So another study which was done was a cumulative blood pressure load and incident dementia, cognitive function, and all-cause cardiovascular death in an older population, that is 70 years and old. And only few studies has focused on contribution of long-term exposure of elevated blood pressure to dementia and death, particularly in older individuals. And older individuals, usually they are neglected, and there is no treatment goals for blood pressure is observed. Many people, older people, higher blood pressure, and they don't control blood pressure aggressively, and that leads to the bad prognosis in this group of patients, leading to various neuropsychiatric problems like dementia, cognitive decline, or all-cause and cardiovascular deaths amongst the adult age of 70 years and above, which were followed up for 15 years. The researchers also explored whether sitting versus standing blood pressure has more predictive value these outcomes. So the cohort comprised of around more 1,000 patients of community dwelling individuals between 70 to 90 years without dementia, recruited from 2 areas of Sydney in Australia, and sitting and standing systolic, diastolic, and pulse pressures were measured from wave 1 to wave 3, and cumulative sitting and standing blood pressure and its load were calculated from area under the curve. So researchers assessed the association of blood pressure parameters with incident dementia, cognitive function, all-cause and cardiovascular deaths between wave 4 and 7, and the cost proportional hazard model was used for the assessment of the results. So around 520 patients with 3 waves of blood pressure with almost 47% median age of around 77, and association, what they found is cumulative pulse pressure load shows the higher risk of dementia and lower cognitive scores, but no significant association with additional age adjustment. Sitting and standing cumulative pulse pressure and the load were associated with higher risk of all-cause death. No significant association was found to cumulative systolic and diastolic sitting and standing blood pressure with dementia, cognition, and all deaths with both crude and adjusted models. So long-term cumulative pulse pressure load predicted the significant age-dependent increase in the risk of dementia, cognitive decline, and deaths in adult more than 70 years of the age. That is what the study shows. This is another study which was published by Guideline-Based Therapeutic Strategy for Controlling Hypertension in Non-Controlled Hypertensive Patients, followed by family physician in primary health care. So this is GPHTPT study, and in the prospective open label study in primary health care by GPs, we evaluated the efficacy of single pill combination of candesartan and amlodipine as the only antihypertensive medications in patients between 18 to 80 years with uncontrolled hypertension, where the blood pressure more than 140/90, either treated with antihypertensive monotherapies or combination with hydrochlorothiazide group 2, and not receiving medication at all was group 3 was studied. So 100 general practitioners recruited the first 25 patients each, and patients without cardiovascular events and with uncontrolled hypertension were recruited, and they were evaluated at baseline, 6 weeks and 12 weeks. And BP measurements of office blood pressure recorded as a mean of 2 out of 3 measurements, and hypertension control definition was less than 140/90 millimeter of mercury, and statistical test was measured using ANOVA test. So out of 1,234 patients recruited, around 362 patients, which were 52% were female, completed 12 weeks of the study. And the group 1, group 2, and group 3, they were divided again according to the severity. Patients were medicated with one of the 3 fixed combination, that is candesartan amlodipine, 8/5 or 16/5 or 16/10 per day. And in group 1, group 2, and group 3, they were again studied. And the conclusion was in patients with uncontrolled hypertension under monotherapy, combination with hydrochlorothiazide or non-medicated, followed by GPs, therapeutic measures in accordance with guidelines, fixed dose combination of ARB amlodipine allowed to achieve hypertension control at 12 weeks in almost 75 to 90% of previously uncontrolled patients, reinforcing the advantage of implementing this strategy in primary clinical practice. So there is another study called Clinical Relevance of Adopting Different Definitions of Nighttime when Assessing Nocturnal Blood Pressure. And this was the study which was done to see the dipping behavior and nocturnal blood pressure using ambulatory blood pressure monitoring. And 30 patients underwent ABPM via validated device, and simultaneously motor activity and body positions were recorded, determining the individual's actual sleep time. So in this, we will go to the end result. The 12 out of 30 patients BP dipping classification change when adjusting TIB individually and considering the BP values during actual sleep. This study highlights that individually determined TIB and exclusion of wake pulses during night is of critical importance for correct assessment of dipping behavior. and may play important role in optimizing the clinical management of the hypertension. So another cognitive function was assessed with the benefits of blood pressure management program, 4-year study of more than 1,000 patients, elderly centers in Hong Kong. They studied the physical and cognitive condition and to see that seasonally fluctuations in the blood pressure, whether they have any effect on the cognitive function of the patient. So retrospective observation study and 500 patients and Framingham risk scores, European risk scores, ASCVD, various risk scorings were used to calculate the cardiovascular risk of this patient, and elderly patient more than 55 years were included. Inclusion criteria were participant who reported more than 80% of weekly BP record in last 2 years of follow-up. Seasonal blood pressure fluctuations were adjusted to the time series model using man-candle test, and logistic regression model was created. So a total of more than 1,000 patients with mean age of 79 years were included in this study, and multivariate model shows that improved BP trends were associated with baseline systolic blood pressure, cholesterol problems, and subjective memory complaints. So the conclusion was seasonal blood pressure fluctuations always influence the performance of blood pressure management program, and time series modeling is possible to figure out the real trend of personal blood pressure records after adjustment for seasonal effects. Study demonstrates that long-term benefits of our blood pressure management program were limited by elderly with memory complaints, and when we are offering blood pressure management program, special arrangement is required for the participant with mild cognitive impairment and or even dementia. So somebody to look after these elderly patients, those who have cognitive function, is very important so that they cannot forget their pills, and the proper medication is given by somebody who monitors them well, so that fluctuations in the blood pressure is avoided and their further cardiovascular risk can be decreased. So response to the blood pressure to renal denervation is not associated with genetic variants, and this was studied using RDN, that is renal denervation therapy, which is now available in our country also, which is brought by a Medtronic company, and almost 268 patients with 35% of the females with uncontrolled resistant hypertension who underwent endovascular RDN were included, and response to 24 hours blood pressure was assessed after 6 months and divided into 2 groups below median response of 6 millimeter, taking pre-interventions ambulatory blood pressure molecule in this group of patient. And the results has shown that response to RDN is not robustly associated with genetic makeup of patient, uncontrolled resistant hypertension, and data does not support the use of genetics to predict the blood pressure response. That is what the study shows. So thank you very much for your attention. Hope these studies will definitely bring a change in your practice, and which will give robust data and evidence for management of our patient in day-to-day practice. Thank you very much.